there is some amount of pressure within your eye which is supposed to be in the range of say about 10 to 20 millimeters of mercury. Now when this pressure within your eye increases, it begins to damage the nerve of the eye. Now this nerve damage doesn't happen overnight. It takes about months and years to happen, and slowly that nerve damage leads to vision loss. Now this vision loss or eyesight loss or blurring of vision is never central, it is always peripheral, and that's when glaucoma does not have any signs and symptoms till the end stage, because whatever nerve damage is happening is not in the central part, it is in the peripheral part. So slowly the peripheral vision is going to reduce. And by the time my patient comes into the clinic and he says that, okay, I'm not able to see from one side, I'm constantly having accidents on one side of, while driving, that's when we realize that the field of vision is reduced. And then once we examine the patient, subjects him to test, and that's when we know that this is glaucoma. So glaucoma is a disease that will damage the nerve of your eye if the eye pressure is not under control, and that leads to vision loss. So glaucoma is called the silent thief of sight. The reason it's called silent thief of sight is, like I said, that it does not have any signs and symptoms in the initial stages, but there is a particular type of glaucoma that is known as an angle closure glaucoma. So in some cases, when the angle within the eye sort of shuts down, there could be a sudden rise in eye pressure, and this can damage the nerve of your eye. So when there is a sudden closure of the angle within the eye, you can have redness, you can have headache, you can have watering, blurring of vision, pain, unilateral headache. This is going to happen only when there is an angle closure, but when you have an open angle glaucoma, you would not have much of signs and symptoms in the early stages, but in the later on stages, you will have blurring of vision. There could be intermittent headaches also if the eye pressure has gone high above. There are various types of glaucoma. First is congenital glaucoma. What do I mean by congenital is that a child from birth can also have glaucoma. Okay, and this is due to certain genetic disorders wherein the child develops glaucoma. So we have the congenital glaucoma. We have something known as the developmental glaucoma, that is going to be that you develop this disease maybe in your mid-20s or 30s. There's something known as steroid-induced glaucoma. This is very, very important, is because we do come across patients who use steroids for longer time. Now, what do I mean by longer time? For maybe months or years together. That steroid could be in the form of drops that he's picked up from some medical counter, or in the form of treatment for asthma, or even steroid sprays that are available, or inhalers. Now these steroids, they do get absorbed in the blood, and they can cause an increase in eye pressure and damage the nerve of the eye. The most common type of glaucoma that is the open angle glaucoma. But in Asians, in Indians, what we see is that we have a mixture of open angle as well as closed angle glaucoma.